Hey guys, we are back with another part 2, actually, episode with Dr. Naomi Albertson, aka Dr. Nice.
Can you really call it a part 2?
Yes.
It's real, but it's like...
It's the second part. It's the second episode.
But it's so different, but it's also so interconnected.
Oh my gosh, you just blew my mind. That's not hard to do, but you did. I blew a fuse, maybe.
Bam. Well, so if you didn't listen to the previous podcast with Dr. Albertson, it was about recovery and sleep and a little bit of nutrition in there and strength training and also talking about her product. She's got a creatine product, Dr. Nice,
yes,
which you've been taking, Matthew.
Yeah, I've been taking it now. I don't take supplements. It's not something I normally do, but I wanted to be able to test out this product and just to see if I noticed any real differences, which I did. And with creatine, I mean, it's been around long enough now that people probably know that it does work. I feel like so many blends out there. We made fun of proprietary, not proprietary. Proprietary, not proprietary. Proprietary. I can't say it. What's it called?
Proprietary.
Yeah, I said it during the podcast, but so that's something where I have a pet peeve about a lot of products out there where they have this, specific blend and you don't know really what's in it. And I would not touch that stuff with a 10-foot pole. And most products, especially pre-workout supplements, guys, I mean, they're just mega dose with stimulants and that's what you're feeling. And, like even with your skin tingling, right? So there's like beta alanine they can put in there. And is beta alanine bad? No, it's not bad. It does help to improve your endurance a little bit, possibly. I mean, there's still, I think the jury's out a little bit more than it would be on something like creatine. But a lot of times they just have things in there so you feel your skin tingling, much like when you wash your hands with soap and the soaps have suds, they have that so that you can see the suds, so that you can see that it's doing something to clean your hands. That's actually like a real thing, I believe. It
was a marketing ploy.
Thank you.
Yeah,
I'm not just imagining that, right? So
you imagine a lot of things, but that's not one of them.
There you go. So, like I said, guys, there's a lot of crap out there, but there are some beneficial things that we can use. And I always say that we have to maximize our recovery first. So you should listen to that first episode. And then it's more about the nutrition. And then once your nutrition is really dialed in, then something of a supplement like Dr. Nice can also, I think, help you to get to that better, more efficient gear for you, but not without the recovery and the nutrition being in place first. And then I think with those things in place, the training can really take off. And that's where, of course, I believe strength training is imperative, but doesn't go so well when you're not recovering well and you can't recover from the training. Work plus rest equals success. So when you're breaking things down, literally and figuratively, we're talking about that result is really comes after you do the work, and it's in your body's ability to sort of absorb the training that matters. So that's where the recovery and nutrition is absolutely 100% imperative. You need that. And with our training series talking about strength, and this is going to be our focus in this batch of podcasts we put out, it's important to me that we talked about these subjects first so that when you are following the advice, hopefully you follow the advice that I give for strength training, this is going to really maximize the benefits and the results for you and minimize our risk of overtraining, injury, things like this.
Yeah, the great thing about Dr. Naomi's Albertson's product is that it really is about performance. It's not about losing weight. It's not about being a meathead.
You mean there's no fat burners in her product?
No.
That's another one.
But what it's really meant to do is exactly what you just said. Like if you're getting your recovery and your nutrition is pretty darn good and you're doing the work in your training, then this is what's going to help you in that recovery and to be able to make those incremental improvements so that over the long term of your performance, you're really making some good strides.
Yeah, absolutely. So, guys, hopefully you get a lot more out of this one as well, and love to hear your feedback. Just know that we are never going to promote something that we don't believe in. It's not about getting some money from a sponsor. It's about serving you guys better today than we did yesterday. That's always the goal. And to do that, we bring in the experts, and Dr. Naomi Albertson is certainly an expert. So
she sure is.
Listen in, enjoy. Hey! Would
you just stop doing that? Just don't.
Hey!
You're embarrassing yourself. You're embarrassing me. You're embarrassing Dr. Albertson now.
I'm Matt Albert.
That ain't right.
Hi, guys. This is the Relative Run Readiness Podcast, and as always, I get to be your host along with Mr. Chad Sweet. And today we have Dr. Naomi Albertson with us. If you listen to the first podcast on recovery, then you know a little bit more about her. If you didn't, I would suggest that you listen to that first, because recovery is to me, the pillar in training, which starts with recovery. And then I would say nutrition and then the training. Now, they're all important, but I believe that if I had to pick an order, that's the order I would go in of importance. So, we talk about training as being something that we all should do on a daily basis, but I hear all different kind of recommendations. We have the doctor in the house, so we're going to talk to the doctor today about what she believes when it comes to advice that we hear. So, for example, 150 minutes a week is what I hear for just, say, walking, right? You want to do some good, just easy cardio even. And then intensity work where you might be on that, that spin bike, or you're doing some intervals of some sort, threshold work, anything where the heart's working a little bit harder. Then I'm seeing the recommendations be around 75 minutes. So it always kind of cracks me up because, of course, who are we talking about and how relative is it for that person? I certainly think consistency is key, especially for just starting off with, say, walking 20 to 30 minutes a day, and you want to feel better, you want more energy, quit taking those supplements that are supposed to be jacking you up and making you feel like you've got all this energy. It's just all these stimulants they put in, which is mainly like mega caffeine. And it's $1 billion industry for a reason, and I think it's bullshit. And I'm just going to say that. And Naomi, now that I've said that, you have a supplement.
I sure do.
So explain to me why it's not BS what you are promoting versus what's out there. And I'm of course leading you into this because I take your supplement. I believe it works, and it doesn't have all that nonsense in it, though. It doesn't have the fillers in it. We want to talk about that a little bit, and we want to just talk about good overall nutrition and how it ties in hand with training,
yep.
Right?
So, Matt, I totally agree with you. It is a multi-billion-dollar industry out there, and it's unfortunate because I think it has kind of talked the general public into like, oh, I can get all my nutrition through these 5 capsules that I take throughout the day, which is complete garbage. That being said, I am, as you know, an MD, and I am a believer in evidence-based medicine, and I think that unfortunately, as we age, the requirements to support normal bone and muscle function change, and it's very hard to get them just through your diet. I encourage people all the time, like, if you can eat your nutrition, do it. Food is, there for a reason. But if you can't, and if you feel like, darn it, I'm falling short, I'm not getting adequate levels of protein, I'm not getting adequate levels of, vitamin D, whatever, then that's when you need to look at it. And I encourage all of my patients, do the math. Look at what you're eating first. If you are already getting the right amounts of vitamin D, magnesium, calcium, proteins, well, stop supplementing. Like, what is the point of it? You're just going to, your body's going to get rid of it. It doesn't need it if you already are getting what you need. What my product is, as you know, is a product that I designed completely based on the research in order to support normal for your entire frame, really. So bone and muscle. And what's in it is what's recommended in the research for normal bone turnover after the age of 35 and for muscle. Now, muscle's tricky because, as you know, Matt, like, you have to do the strength training. Like, there is not anything that's going to make you strong if you're sitting on the couch doing nothing. And so, you still have to do the exercise. That's just part of the equation. You have to give your muscles what they need. They need amino acids. They need, which is proteins typically. You can take branched chain aminos. And as you know, leucine's getting a lot of press as one of the essentials. That being said, I think, giving your body the addition of something called creatine can also be really helpful to not only slow down muscle wasting that happens naturally with aging, but also to increase strength. And so I think for those of us who are older than 35, right, unfortunately turning 50 this year, I think giving your body what it needs to minimize losses and continue to see increases is critical.
Now, Dr. Albertson, you mentioned creatine.
Yeah.
And I think for a lot of people, that equates to muscle heads. That equates to gym rats.
Absolutely.
Not necessarily, hey, I'm over the age of 40 and now I want to go run the trails or something like that. How is creatine helping me in
Absolutely. So it's such a great question. So creatine's naturally occurring. First of all, your body makes it. Between your liver and kidneys, you make a small amount of creatine. It hangs out primarily in your skeletal muscle. And that being said, unfortunately, as we age, we make less. Right? So we got to get it from some exogenous source. And the two primary sources through our diet are red meat. You'd have to eat a pound a day, or salmon. And I mean, that's a whole nother discussion. We could talk about mercury and big fish and what's happening to overfishing in the oceans, et cetera. So, I mean, I tend to tell people, like, if you are interested in giving your body adequate levels of creatine that can be stored and used for your muscle function, then you probably are going to have to find a supplement source for it, because chances are you're not going to eat a pound of grass-fed beef every day, right? So what the heck does it do? So, I mean, your body, like I said, is naturally making this stuff. What it does is it hangs out in your skeletal muscle. And then when you do a contraction, whether it's, a push-up or a pull-up or a, bench press or a curl or whatever it is, what happens to that creatine is it's hanging on to some extra phosphates in your muscle. And so it frees up a phosphate to make an energy molecule, so an ATP. So it turns an ADP or an adenosine diphosphate to a triphosphate, and it allows for a bigger muscle contraction. So like I said at the beginning, like, you still have to do the exercise. Like, this stuff is not magic. It's just going to work if you're doing the exercise. So if you do that, right, this is how we build muscle and how we build strength, is if you consistently get a bigger contraction, then you will see strength gains over time. And typically creatine, when you supplement it in low doses, just 3 to 5 grams a day, you should be able to see strength gains typically within 2 to 3 weeks.
Yeah, no, I've noticed that myself. Now, I don't take supplements. Sometimes I will have a protein bar or protein shake, but I think a lot of that is overrated. And, even with the essential amino acid conversation, I think that if you're just getting in a good overall nutritious, well-balanced program, and I don't even say diet, right? Because I think that energy in versus energy out, it still comes down to that equation. Are you getting in enough calories? That's always the first question to me. And then when we're going through some progressions in strength and progressive overload, that's where I started to just kind of test out the product a little bit more. And I think it's now been around for 20 plus years. There's a lot of evidence. You actually have on your YouTube channel, you have a great description of creatine and what it does for you. Is that Dr. Nyes? Is that the YouTube channel?
It is. And all of our, YouTube videos and podcasts can be accessed through our website, which is www.boneandmuscle.com. But yes, I mean, I think the video that you're referring to, Matt, was, a video we put out about what creatine is from a medical perspective, because there are, like you mentioned, Chad, I mean, there's a lot of muscle heads out there who are already familiar with creatine, because it's been on the market not 20 years, but 55 years, believe it or not. And, when it first hit the market, unfortunately, it got a bad rap because people were using huge doses of creatine, so 20 grams plus, and at the same time pushing their protein levels to 300 grams plus, and then cutting weight, right? Dehydrating. So that's not a good combination for your kidneys ever, to dehydrate. And when you've got that much load with protein and or creatine, it also is not great. And so thankfully, those issues have been studied over the last 55 years and shown out that creatine is very safe. It's very effective. I put my elderly patients who are recovering from surgeries, recovering from illness, recovering from, injury on low doses of creatine, because I don't want them to get weaker because they're not active, right?
Right. And in strength training, I'm going to explain a little bit as a runner why this works for me, because it's not about getting my swole on, okay? I mean, it's maybe a side effect of having better aesthetics, but the athletics are what I'm more concerned with. And if I'm running, let's say I'm getting ready for this mountain race and I'm trying to average, 6:30 per mile in the mountains, okay? That's actually that's a tough thing to do in the mountains. So how strong I am absolutely matters. Now, when I go into a strength program where, let's say that I was doing something at 8 reps until I feel like I tested at 8 reps and that was like the best I could do. And now I can do that same weight, but I can do it for 10 reps, or I can do more weight at 8 reps. Whatever it is, point is I'm getting stronger. Now, why that matters, guys, is because when I go out there to distribute power for power economy out in the mountains, when I am doing that same mountain run, it might be at, say, 70 to 80% of my max effort, whereas before I was closer to 90% of my max effort to do that same course. Why is that? Because the stronger my base is, the more force I can produce, the less force it takes me to be able to do the same pace, right? So in other words, now I can go to, if I want to test myself, I can do that same course and go all out, and I can run it faster. So a good example, I think, is, for example, when you look at Mike Tyson's last fight. And I heard Joe DeFranco talk about this on his podcast. Makes perfect sense, though. People were talking about his endurance in that fight, and he was just basically the same Mike Tyson, just older, has incredible power. But when he was throwing punches, he was only throwing probably at 70% of his maximum effort, right? But it's punishing his opponent at what that guy can do at 100%. If he throws one good punch at 100%, he might be matching Mike Tyson's 70%. Why is that? Because his max base strength is just so incredible, right? But that is where I think we can improve power economy just by improving our overall base strength levels. Now it just takes less to do the same thing. Now my heart rate is lower, etc. And last point I want to bring up, but stuff like TRT, is testosterone replacement therapy, guys. It seems to be rampant, and I keep hearing about it, and I keep hearing about guys that are doing it younger and younger. And I don't want to name names, but just talking to somebody recently who's like 35 years old and starting on TRT. And look, I'm 48. I don't want to rely on stuff like that. And the thing is, what I know about a lot of these people taking TRT is they don't have their recovery down. They don't have their nutrition down. Their training can be stupid. Okay. And in other words, they're trying to do the same training they did in their 20s, and they just can't get away with it anymore. So, to me, you can't cheat the system like that. Eventually you have to pay the bill. And starting on TRT, look, if anybody's doing it or on it, that's your choice, and I respect that choice. I'm just saying, for me, I don't want to mess with my hormones. I want to find out how I can find a good balance. And then if I can get a good edge with something that I feel like is good for me and is based off of science, what I can do long term, then I'll do that. So a little bit of a loaded question, but first of all, Chad, did you finally get off the TRT? I was talking about Chad in that scenario.
I never have, nor ever will I take TRT, because I don't want to be like you, Matt.
You'll never be like me. That's assured. Okay. I just wanted to point out though that with somebody like myself with these kind of competitive goals, I also would consider it to be cheating if I took TRT.
Absolutely.
I think it is
cheating. I mean, I think it brings up a whole nother podcast, frankly, that we should have, which is about performance enhancing drugs and the history there, maybe, and sort of why they are not good for you, and exactly what you're saying, Matt, of why how advanced these things have become, unfortunately, and how available they are has been problematic for sure in the sports medicine world for eons. But I think your perspective, of course, of taking a more realistic look at your training and at your recovery. I mean, and here we are talking about recovery, really, but we've kind of gone on a tangent really about well, shoot. I mean, if you're stronger to start with, does that somehow improve your recovery, right? And I think, that's something that, is a whole nother podcast, frankly.
Yeah, no, absolutely. And when it comes to the training, though, strength training in particular, one thing I wanted to bring up was just if I put in a quality day on Monday, first of all, I'm going to do, say, some threshold work in my run. Okay, so I might do some thresholds, some tempo running, something like that. And then I'm going to get in something to eat. I'm going to recover a bit, and then I'm going to get in my strength training. And I like to do those on the same day. Now, Tuesday and Wednesday are easy days for me. And I'll especially make sure that I'm paying attention to, for example, my heart rate. So I will make sure that I'm going at a slow enough, easy enough pace where it's like a Kenyan shuffle I run at. And it's amazing to me how many people that just run too hard on their easy days still. But I believe in getting a good full 48 hours or more of recovery before I'm going to do another quality day. So then Thursday, I might do, say, some intervals, and then I will do some strength work that kind of matches that theme where I'll do actually more power work on that day. So Monday for me in the strength room was a little bit more about my overall strength, muscular endurance, etc. And then on Thursday, it's going to be a little bit more about plyometrics and more for tissue tolerance, more for tendons, and more for that sort of adaptive response. So that's just an example about how I can recover properly, but also use something like creatine to be able to maximize my reps on Monday. And like I said, I've been just fairly new to using this product, but I've noticed a difference in my max reps. And then on Thursday, can I now do, let's say, some more dynamic effort work or some plyometrics, and can I do that faster? And I go really alactically there. I tend to go in 6.5 seconds or less for power work. So that's where I think creatine can really show up and help out when you're talking about improving with that combo, of your strength, endurance, and then getting in some better power. So that being said, when it comes to your nutrition and it comes to the training, I think that we just want to steer people in the right direction about not trying to find something that is maybe untenable tested, or when I say cheating, guys, by doing something like TRT, like if that's your choice, if you want to do that and you're not going to compete and try to win titles, again, I'm not judgmental there as much as I would be maybe somebody who all of a sudden seems to be finding a second life when it comes to their competitive edge. But for everyone, and including my own sister, I told her I would send her a link to this podcast when it was out. I get mad at the information that's out there because she's done a wonderful job at getting herself healthier and happier, and she's losing weight. But, she texted me and said, what pre-workout supplement should I take? And this is somebody who's on her way to finding the best version of herself, but there's still some work to do. And my heart just jumped, like just thinking about some of these supplements out there that I think are, really dangerous, but also I think leads to depression, right? Leads to a lot of hormonal imbalances, things like that. So I think I convinced her not to take anything like that, but it's just so easy, right? You see the picture, you see the person you want to look like on that picture. They're apparently taking this product, which I can tell you they usually are taking a lot more than that product, if they've even taken that product at all.
Right.
So what's your thoughts on that? I'll let you kind of close up with that.
I think, Matt, you've hit on a whole bunch of different issues. I think, as an athlete, as just a person, right, aging, I think your body needs recovery, period. And in our last podcast, of course, we talked about sleep and the importance there of, for recovery. I think the nutritional piece is much more complicated, depending on your activity levels, but absolutely. Having, have a dietitian or a professional, a nutritionist help you along those ways. If you're not sure, right? If you don't know what you should be eating for your activity, then, reach out to somebody and get some help. Where my product kind of falls into the milieu here, or the whole, picture, really is for people who are already doing the exercise, right? It's for people who are interested in performance, who are trying to maximize their performance, whatever that, that looks like for them, whether it's, racing or whether it's training, and where it really falls into the mix is not only, again, to improve strength and frame support. And I want to come back to that because I think we sort of forget sometimes about some of our athletes who are either, overtraining or under recovering, who wind up with injury, right? And that's usually where I see them in my office. And I might see them for a tendonitis, but I might see them for that stress fracture, right? And I get asked all the time, like, why do my joints hurt more as I've aged? Because you're telling me that my joints have probably been pretty similar for the last 10 years. And it has everything to do with muscle loss, right? So when your muscles aren't controlling those joints, you're going to feel them more. Right. And so I think, again, coming back to this concept of I got to support your muscles, but I also have to support your bones, because your bones will feel the effects of overloading. And that's where we start winding up with things like stress fractures. And stress fractures, the incidence of stress fractures are typically in growth phases. So in our younger athletes who are, growing and have higher metabolic needs and are just not keeping up with their nutritional requirements. And believe it or not, in our 40s, 50s, 60-year-old active athletes who are also not keeping up with their nutritional needs. And so, and or overtraining, under recovering, right? So, I think you have to look at all of this stuff as it's all together. Like you can't train and, not get adequate sleep and get decent nutrition. That's not going to end well, right? You can't train and get great nutrition and not sleep. That's not going to end well. So you got to put it all together at some level. And again, I think, getting advice from somebody who specializes in nutrition is certainly reasonable. There's wonderful sports nutritionists out there. There's so many, great position statements from some of the academies, like the American Medical Society of Sports Medicine, and then also like the International Society of Sports Nutrition. And I think, they publish, recommendations for active aging athletes. And so, I mean, I think getting yourself educated so that you know what you should be doing from a nutritional perspective, and then kind of dialing it in, is the answer.
Are you saying we shouldn't trust the salesperson at GNC?
Should you not trust the proprietary blend?
I think that you should not trust the proprietary blend. I think that you should get educated about what you need, and you should trust, medical sources that have adequate research behind them to make the recommendations they're making.
Yeah. If something's too good to be true, it probably is. There's no shortcuts. People, have that magic pill. You want to take that pill. You want to get that shortcut. It doesn't exist, guys. It really doesn't. And of course, admittedly, there are things like, again, TRT is you're going to feel a lot better. But I believe that, well, I shouldn't say that. I feel good. Now I'm sad. But those kind of ideas, I'm not completely opposed to it. I think there are people who might need that kind of help, but it should obviously be something that is really researched and looked into. Just like when we look at people who are struggling with their weight and performance, and they say, okay, coach, what did so and so eat when they were running this way? That's what I'm going to eat. It's more about write down what you're eating, but actually look at the labels. And by the way, the more labels that you're looking at, probably the worse it is for eating whole, real, fresh foods. But point is, actually know what you're putting into your body. And it comes down to, again, how much fiber versus refined sugar or other fillers are in there. And it's no different with when you're taking a nutritional supplement, which should truly just do that, supplement something you're doing. But if there's, blends in there that you can't really figure out, or they won't give you the numbers, and just put it down. And for the most part, I think stay away from any supplement that you don't truly understand, that you haven't researched, whether or not, no offense, it comes from a doctor or not.
I totally agree. And honestly, I was sitting here nodding, thinking, I tell all my patients, if you can eat it, eat it. There's not any reason you should get anything out of a bottle, jar, pill, if you can do it through your nutrition.
That's right. And I think eating enough creatine every day could run into the problems of, like you said, salmon, mercury, steak, too many saturated fats. That would be really tough to do. So that's where I think it can help. But also, I would say that I would still promote always more cycling on and off of stuff, even things that I think that can be really good for me at times. I don't feel like I should be always on certain things besides just whole foods all the time.
I think you're right, Matt.
I'm always right.
I would disagree with that. You're not right about that.
Well, this, guys, has been another amazing episode of Relative Run Readiness with Dr. Nye. We're so lucky to have Naomi Albertson with us. You're going to hear a lot more with Naomi, and hopefully more from Naomi than Chad over there.
What the what?
But we are collaborating, and I will say this to you guys, this is not about a sponsorship. Naomi and I have been working together for years with athletes. We're good friends. I completely trust Dr. Nye, but also I just think this is better information that we can get out there. If you're going to use something to help supplement your goals, then that's where I believe in Dr. Nye's product. So don't take any money for saying that. It's just something I use and I believe in it.
Where do we find your product, Dr. Albertson?
You find it at www.boneandmuscle.com.
That's beautiful. All right. Thank you so much.
You're welcome. Man. Thanks for being here.